Welcome to another episode of the Milwaukee Sports Performance Podcast. My name is Michael Falk. I am going to be walking us through how we can prevent injuries in baseball players. The baseball season in high school is about to kick off in 2 weeks in Wisconsin. Players are throwing their last couple off-season bullpens with their club teams and getting ready for the start of high school season with tryouts and then jumping right into the season. It is an exciting time of year. The weather's getting nicer and everybody's excited for the start of a new year. One of the concerns with early season baseball is we do see a rapid spike in injuries. Our office is always packed with free injury consults, doing injury evaluations with sore shoulders, sore elbows, particularly of pitchers, but sometimes of position players as well as the baseball season ramps up. So I wanted to record this episode and walk through things we can do to try and decrease arm injuries and pain in high school baseball players. Before we can start talking about what we can do to prevent injuries, we need to talk about what types of injuries are we seeing, okay? By far the most common injury that we are seeing is in the arm, particularly the throwing arm. Shoulders and elbows are going to be the first and second largest things that we see, or most frequent things that we see in our office for these players. I think an easy way to break this down is to start talking about what types of things we see based off location. Most people don't know all the structures. You probably heard of the UCL or the Tommy John ligament, the labrum, the rotator cuff, but it doesn't always correlate with what you're feeling and where things hurt. So let's break it down by location. First area that we see a lot is pain in the front of the shoulder. We're thinking about a few things in this situation. There's something called anterior impingement. That is just a fancy medical way of saying that something on the front part of your shoulder is irritated. The front of your shoulder is a very busy place. We have the anterior capsule, which is like a thickening of the ligament. We've got the biceps tendon. We've got some other muscles, subscap, that attach in the front of the shoulder. The rotator cuff runs through the underside of the front part of their shoulder. And you have a thing on top that you can feel. It's like a bony prominence. It's like the roof of your shoulder. It's called your acromion. There's a lot of stuff in a very small space. If those things get swollen, irritated, painful, the space gets even smaller and we can start to have pain or a pinching sensation in the front part of your shoulder. Okay, the other thing that we can be looking at here is the biceps tendon, and this is commonly going to be labeled as biceps tendonitis. It is a catch-all. We'd call it like a junk diagnosis. Not always right. It gets blamed a lot of the time, but that is another very common diagnosis. Some of the things that we can be thinking about that's maybe a little more significant could be a location of having some pain if you have a labrum tear, particularly like a slap tear. This is very uncommon, especially in young throwers. It's not completely ruled out, but it is not something we see frequently. It's something that everyone's worried about, and understandably so, as it is a major injury and issue, but it is relatively rare in young throwers. Finally, if you are a younger thrower, still growing, we can be thinking about Little League shoulder in this area. Little League shoulder could also present as front of the shoulder pain. Lots of potential things are going on if you're feeling discomfort in the front of your shoulder. Often the front of the shoulder is where the pain occurs, but it's not always the reason why. Most commonly, we'll see players in the front of the shoulder pain, no significant structural issues, not even something we can really slap a diagnosis on. They present with weakness in the back of the shoulder. They present with a humeral head that's sitting very far forward. So the ball is sitting very far forward on the socket and it's putting pressure on the front of your shoulder. We see lack of range of motion and overhead mobility, internal rotation. Those things can be causing increased stress on the front of the shoulder. The result is discomfort from overuse. The front of the shoulder can take some of the brunt of the forces if other things are not doing their job as well, and can sometimes be more of a victim than the real problem. If we shift gears and start thinking about the back of the shoulder, there are a few things that we're thinking about. Your rotator cuff is back there. It is very rare, almost unheard of in a young, healthy athlete to have a rotator cuff tear of any significance, but it is potentially more common to see a rotator cuff strain. Just like you could strain a hamstring, you can strain really any muscle, or just like a rotator cuff tendonitis, tendon issue, pain back there. It could also just be general overuse. We're just beating the back of that shoulder up, throwing too much, and it's just hurting with no true structural diagnosis. And then there is something called posterior impingement. This is a specific condition that really is only going to affect pitchers. It is going to happen at a specific point in the throwing motion during maximal layback. When your arm gets all the way back there with the ball, we are going to potentially feel a pinching in the back of our shoulder. That is classic sign of posterior impingement. This is not something that is a massive structural issue or really anything to be overly concerned with. It is something that needs to be addressed. Typically, we're going to again find the rotator cuff is not functioning well to keep that ball centered on the socket. Some of the tissues in the back of the shoulder end up getting pinched. We'll find some range of motion issues or some inefficiencies with how your arm is moving, and it will respond well to rehab over time. Basically, we're left with pain on the outside. This can be a variety of things. If it's going down the arm, that classically is something that we've seen a little bit more in little league shoulder, having bony pain on the lateral outside of that shoulder. It might be indicative of a little league shoulder if you are a younger player that is still growing. That's going to be more pain in the armpit, potentially up in the shoulder. We also would be thinking about pain that's referred from the neck. Just because we hurt in an area doesn't mean that the pain itself is coming from there. Could be that we have an irritated nerve or sore neck, something like that is causing pain down the arm. So those would be things that we'd be looking at. If we shifted away from the shoulder, the next most common thing we're going to see is discomfort around the elbow. Again, we can break this up on location. We have the inside part of the elbow, the outside, and the back of the elbow. We'll start with the inside part of the elbow. Every player that feels any discomfort on the inside part of that elbow is always concerned about, do I need Tommy John surgery, right? That is where that ligament is. Most people's favorite pitcher has gone through a Tommy John recovery at some point. It is a major concern for players and families that they want to rule out. But there are other structures there as well. If we're experiencing pain on the inside part of your elbow, it is always something that you should get checked out by a medical provider. The major things that we're going to be looking at are that UCL injury. Does not mean that it's totally ruptured, does not mean that you have to get it reconstructed and go through a Tommy John. It could just be a minor sprain of the UCL that we'd want to get checked out and rehab appropriately. The second thing is we have 3 muscles that run through there. The flexor pronator group is going to cross the elbow. We can have a flexor pronator strain. We can have a flexor pronator tendonitis or irritation in that area. That is going to be very hard to distinguish from the UCL itself because those structures run closely together. The third thing we're going to be thinking about is an ulnar nerve issue. So your ulnar nerve runs through the inside part of your elbow. It can get stressed a lot in the throwing motion. Some people can have anatomical differences in their ulnar nerve where it can get stretched or slide in and out of an area and get irritated. That's typically going to present with unique characteristics of how it hurts, when it hurts, and what it feels like, as well as having symptoms that go farther down into your forearm and into the outside 2 fingers in your hand. It's going to be classic nerve irritation. The fourth and final thing is in a younger player, again, little leaguer's elbow is going to be an injury and stress to the growth plate on the inside part of that elbow. These things do not have to be isolated. We can have multiple things that go on at once where you can have some type of ligament sprain combined with a stretch to the ulnar nerve or a flexor pronator strain combined with a ligament sprain. So these things can be interrelated. But we should check them out because typically we're not seeing athletes dealing with pain and discomfort on the inside part of your elbow, especially in our younger players. If we are feeling pain more on the outside part of your elbow, there is not as much stress that occurs in the throwing motion. We have some tensions. In this case, it'd be the extensor supinator group. More common is we're going to see a joint irritation on the outside part of that elbow. In particular, we're going to be worried in younger players with something called an OCD. If we're getting gapping on the inside part of the elbow when we're throwing and stretching, we can get some compression on the outside part and irritate the joint by kissing those 2 joint surfaces together on the outside part of your elbow. We would want to check that out. Other than that, there's not a ton that's going on the outside part of your elbow. The third area is going to be the back of the elbow. The most common thing for this is going to be a posterior impingement. When we're throwing and releasing a baseball, we are firing the elbow into hyperextension. We've got 2 bones back there, and we can pinch those bones together. We could pinch some of the soft tissue structures between those 2 bones. We can irritate the joint surfaces. We can irritate the bones. We can get something called a posterior impingement. The other thing that we're going to want to rule out in the posterior back part of your elbow is triceps tendonitis. Triceps get irritated in our throwing athletes as well. The most common thing that we're going to see is probably back pain, either in the upper back, in the thoracic spine region, potentially the neck, but really in the low back, we're going to see a lot of pitchers that deal with some irritation and tightness in that area as well. Typically, this is going to be something called nonspecific low back pain. It is a relatively unrewarding diagnosis. Everyone wants to be told some structure that's irritated. And the truth is, in the low back, we often just don't know, and it doesn't really matter because it will typically get better quickly without large-scale interventions. Often we're going to find some hip weaknesses. We're going to find some hip range of motion issues, some T-spine range of motion issues, a variety of things that might be contributing to some increased stress on the low back. And quite frankly, sometimes your back just hurts for no apparent reason. It responds very well to continued movement, rehab, staying active, and not just resting. In certain athletes, there's something to be mindful of called a spondylolysis or spondylolisthesis. This is the start of a stress reaction in your low back. It's very common in young athletes that do a lot of extension rotation sports, where they are constantly rotating and firing into extension through that low back. Puts pressure on the joint surfaces and the bones back there. Sometimes in developing athletes, that can cause stress. And it should be managed conservatively, typically with imaging. It responds well to rehab. It's not something that's going to require surgery. But the sooner we intervene, the faster the recovery is going to be. And it's something that for athletes staying in the gym, staying with our core strengthening, continuing to keep our body healthy is going to help with those things. We see a lot of other things, the typical aches and pains, the hamstring strain, the knee that gets tweaked, we rolled an ankle, but there's really nothing else that stands out to us compared to these specific issues in baseball players. So now that we've laid out what we see, let's talk about some preventative ideas. What can we do so that we stay out on the mound and on the field competing? This is the most important aspect that we want to do. Number one, first and foremost, is appropriate workload management. If you have been throwing all offseason and gradually building up your arm, exposing it to stress, getting the tissues surrounding the inside of the elbow, the back of the shoulder, the back, all ready for the stresses and the demands that you're about to put on it as practice ramps up. If you were late starting a throwing program, if you didn't do an off-season throwing program, right? This early part of the season, you need to take it slow. You cannot jump in on day one and expect to perform like someone that has been throwing since December if you haven't touched a baseball until late February. We need appropriate workload management and a build-up. Typically, we'd like to see your bullpen count exceed the number of pitches you throw in a first game. Anecdotally, if you've thrown 40 pitches in a bullpen, I'd feel comfortable with you throwing 20 to 30 pitches at the most in your first competition. If you've thrown more pitches than that in a bullpen, we can bump that pitch count up. From there, we'd like to see pitch counts increase by 10 to 15 pitches per week. And we'd like to see high school and younger athletes have one outing per week combined with a side bullpen or some other type of throwing program to keep the arm moving and allow the athletes to work on things without overusing them throughout the course of the season. It is a long season, and high school players, it's getting longer. Usually they're going from high school into travel baseball and potentially into fall baseball. So the season is getting very long. It's almost mimicking the MLB season, but these are skeletally immature athletes that do not have the lifestyle habits, the strength, the years of throwing that the pros get. So we do need to be very careful with their arms. And it is something that we see quite a bit with players that have pain in our office, seeing mistakes that were made in the build-up and workload management side. The second thing that we need to do, and players, this is really on you. You need to do your warm-up every day before you throw, and you need to take it seriously. If you just go through the motions, you're not going to get a lot out of it. But going through a well-structured, detailed warm-up is a nice way to help you maintain your range of motion, maintain your strength, and help reduce your risk of injury, as well as increasing your performance. If you do not have a good warm-up routine, shoot us a DM, comment on this podcast. We would be happy to send you an example of something that you can do so that you can be consistent with this every single day as part of your routine. Next, we need a good post-throwing routine. This is going to look different on different days of the week and for different athletes. If you are an athlete that tends to get tight, this might need to be more focused on restoring and regaining your mobility. In other athletes that have too much motion, this might be more geared towards strength maintenance. We can also use this time as a way to maintain strength throughout the season, combine your workouts, maintain mobility. We suggest that you individualize this to your specific needs. A post-throw is a really good time for you to put in work that is relevant to you that will help your arm and body stay healthy across this long baseball season. The next thing is lifestyle habits: sleep, nutrition, hydration. This is the lowest hanging fruit in many of the players that we see that are not going to bed on time, not getting the appropriate amount of sleep per night, not staying well hydrated, and they often don't think it matters. It matters immensely. The research on it is staggering in terms of how much we can reduce our injury risk by taking care of these little things: getting 8 hours of sleep a night, eating enough, eating a well-balanced diet with enough calories, and getting a wide variety of the nutrients that you need, combined with drinking enough water. It is one of the biggest performance enhancers that you will have with the player that you're facing and the team that you're facing. If you do those little things, you are going to be in a better position to perform than them, and you're going to stay on the field for longer. If you don't do that, there's really nothing else I'm going to talk about that is going to help you overcome not doing the simple things really well. We want to maintain our physical capacity. We want you to be you every time you touch a baseball, and your body changes every time you go out and throw. If I took your range of motion and I measured your strength, and then you went and threw in a game, a long outing, and you came back in my office and I remeasured your range of motion and strength, they would not be the same. Throwing a baseball, your body will change as a result. We want to restore you to your baseline before you throw the next time. This should be something that's monitored and individualized to you, can be incorporated in your warm-up, your cool down, your in-gym workouts, but we want to see you be you every time you touch a ball and do that consistently over the course of the season. One of the great ways to do this is to maintain your lifting routine in season. Some days might be lower intensity days, some days might be more geared towards recovery, but following a well-designed strength conditioning program 1 to 2 times per week all the way through the season is going to help you maintain your physical capacity and decrease your injuries. It needs to be timed appropriately throughout your week so that it does not impact your performance and it does not send you out on the field fatigued. It should be a regular part of your routine and a key part of staying healthy across a long season. If we've done all those things, then we can talk about other recovery modalities. There's things like manual therapy, dry needling, massage, soft tissue mobilization, joint mobilization that might help you recover, get your muscles in a better spot, maintain that range of motion across the course of the season. Those can be good tools for players. We can do things like cryotherapy, whether it be cold plunges, whether it be the cryosaunas. Those things might be able to help recover. There's going to be a variety of other modalities, things like the Normatec boots for compression or the Mark Pro for trying to get the muscles to recover that are more passive. Those things can be helpful, but they are not going to be a Band-Aid if you don't do everything else I've talked about. We need to prioritize our recovery, focusing on the main things. I will be recording another podcast about recovery that will go through some details of different options and which ones might be the best fit for you. Let's talk about some specifics. It's key to maintain your strength and range of motion throughout the season. How do we actually do that? First and foremost, monitoring is key. If we don't know what you look like when your arm is feeling good, fresh, and not hurting, it's hard for us to design a program. Some players are going to be hypermobile. We have measured players that have as much as 165, almost 170 degrees of external rotation or layback in their shoulder. That is almost 2 times the normal average. We have measured other players that might only get to 115, 125 degrees. Both of those player archetypes have been very successful, but they should be doing very different routines. And we should be monitoring what changes after outings, what changes week over week, so that we help them stay within a bandwidth of what is relatively normal. We can do the same thing with strength, where we can look for large changes in strength or rate of force development over the course of the season that might be indicative of fatigue or need to design a routine. Monitoring regularly, at least once a month, is going to be key and something that you should utilize. We want athletes to take an active role in this. We suggest doing the same warm-up every day, and for athletes to bring a high level of intent into their warm-up where they feel for differences. Hey, yesterday it was easy for me to get my arms overhead. Today, that right lat feels really tight and I can't get it overhead. I can only get it to about my eyebrow, right? Or yesterday I could get my arm overhead and keep my elbow pointed straight forward. Today, when I get my arm overhead, my elbow bends and my hand rotates out. These are subtle differences, but the athlete being well invested into a consistent routine can detect some of these changes, can be a great way for them to identify specific areas outside of their normal bandwidth they might want to target. Some specific mobility considerations that we see a lot. Players typically lose overhead mobility. That's often going to be due to posterior shoulder tightness, lat tightness, or lack of T-spine extension. And it's something that we want to look at and examine. It can also be the relationship between the lat and the rib cage and how stiff the rib cage is relative to the lat. We want to look at those things, but those would be specific areas that we check out and that you could target in your routine. The second thing we're going to see is players that get tight in layback or external rotation. If we're seeing that, it's going to be the internal rotators restricting that motion. Things like the pec, the lat, and the subscap could be getting a little bit tight. Again, the T-spine that loses a little bit of motion could restrict that. Typically, the more they throw, the more layback or external rotation they pick up. After a period of not throwing, the arm gets tight, and we want to make sure we restore that range of motion. The next most common is going to be internal rotation deficit loss. This needs to be assessed by someone that knows what they're doing with baseball players, because the vast majority of baseball players will have less internal rotation range of motion. It's actually helpful for performance. It needs to be assessed appropriately. If we lack that range of motion, it's typically going to be the posterior cuff, posterior capsule of the shoulder that gets beat up, overused, scarred down, gets really tight. We're going to want to restore some of that motion to free up that arm and help with that. Strength-wise, we want to make sure that we're maintaining the eccentric strength of the posterior shoulders, the ability to decelerate that arm. We want to make sure that we're keeping the rotator cuff well balanced with an appropriate ratio of external rotation strength to internal rotation strength. If we see one get too much stronger than the other, the ability of the rotator cuff to stabilize that humeral head and keep everything in a good orientation could be impacted. That can put stress on different structures. A common pattern we see is the posterior cuff gets a little bit fatigued, gets beat up over the course of many outings, isn't functioning at its normal optimal level. The body's response is that muscle is a little bit weak relatively. The body actually tightens down that rotator cuff. The result of that, it almost pushes the ball forward on the socket. That'll start to put stress on the front parts of those shoulders. And now we're seeing the player that has anterior front of the shoulder pain. We like using things like isometrics in season because they can be scaled to work on maintaining maximal strength while not overly fatiguing the players. We can also make them a little bit easier if we need to. There's not a lot of motion, so it's hard to do them wrong. It doesn't take much time or equipment. So while you're on the road traveling, it's really easy to stick to that routine in the program. That's something we've utilized quite a bit with players. If you're just incorporating some arm strengthening into your workouts, this might not be an issue for you. That alone might be enough to maintain the strength and the balance over the course of the season. It's just something that we would want to monitor and watch out for. And then forearm, we're going to really want to maintain the integrity of the tendons and the muscles that protect that UCL. Again, this is another way that we use the Flex Pro Grip in our office, but if we don't have access to that for players that are on the road, we'll do a variety of isometric pushes using the finger muscles, specific intensities and time holds to work on either recovery and tendon maintenance, strength maintenance, and trying to keep everything really stiff and strong to protect that UCL over the course of the long season. Those are some specific things that we might do. The last piece of advice that I have is how do you structure all this together? Because that really does matter. We want to keep the high days high and the low days low. What do I mean by that? Our high intensity days should be coupled with some of our highest intensity arm care routines. You should pitch, perform your outing, and do your hardest exercises within 24 hours of that appearance, ideally right afterwards. That should allow you to then have a low intensity recovery throwing day coupled with a low intensity arm care and mobility maintenance type day. We're really giving your body, your nervous system, the muscles, the tendons, the joints, all time to recover. When we spread the high days out where we throw hard one day, lift hard another day, throw hard again, we never have a recovery day that your body gets to just recuperate. How you put things together in your week can make a huge difference on the outcome and the effect. If you have any specific questions about that, please don't hesitate to reach out, comment on this podcast, reach us at our website. We would love to help out and chat with you about your specific routine. If you enjoyed today's episode, share it with a teammate, subscribe, leave a review on the podcast, and we will see you on the next episode.